Good afternoon, everyone. Hope you're enjoying some nice weather. I'm in clinic, and this afternoon we're going to spend some time talking about manual lymphatic drainage. It's a therapy that we have used for our surgery patients for the past 7 or 8 years. And I'm going to have our first therapist join us, Petra Irvin, who's now moved back to Northern Ireland. So just waiting for her to come in, and then we'll have lots of questions, and hopefully there she is. Petra has joined. Yep. She should be coming. In the meantime, well, there she is.
Hello.
Hi, Petra. Good to see you.
And you. It's been quite a few years now.
Been a while. Well, nice. Really, really good to have you join us to talk about your favorite subject and my very passionate subject as well. So, I think Nicole has already given you some questions to get started. So
Yeah, so I have them in front of me.
Yeah.
And thanks very much for having me, Chris. It's really nice to be invited on your live.
Yeah.
So the first question is, can MLD help with pain post-surgery?
Yeah. Well, I think that's one for you to jump straight into, isn't it?
Well, the short answer is yes.
Yeah.
MLD is so gentle, and it has an analgesic effect. It switches off the sympathetic nervous system, so the parasympathetic nervous system can come into control. It's relaxing, and it just definitely reduces pain because it's reducing the swelling post-operatively.
Yeah. I don't think we've seen that over the years since we started off together. I got a scary time ago, long time ago. That how positive the experience is for our patients in helping with their recovery, with their healing. So it's something that we're all very, very positive about, and it's helping our patients understand the benefit of it.
Yes, great. I mean, I just think it is wonderful that you've continued to provide it on site to your patients, and I wish more and more surgeons were as open-minded as you are, Chris.
Yeah, well, we've always looked at the whole patient and tried to make sure that we do the best we can to optimize their pre-operative preparation, their surgery, their post-operative care, and very fortuitous us meeting on LinkedIn and having a chance to discuss lymphatic drainage therapy and the benefits. So, what I'd say is that Petra, if you can explain how the technique of lymphatic drainage works.
So it's a gentle pumping form of massage. It's not specifically massage, but it's a type of massage, and it's a skin stretch, and it's encouraging the uptake of fluid into the lymphatic system. And the lymphatic system is your fluid waste system, and it is responsible for draining fluid from the tissue spaces in your body. So the lymphatic system works in conjunction with your venous system, and in normality, you will have fluid that filters out of the vein walls into the surrounding tissues. And in that fluid, you have blood proteins, fat cells, hormones, all sorts of other cells and proteins. And the lymphatic system's job is to pick up that fluid and transport it to lymph nodes. Lymph nodes work like filtration stations and filter out any damaging cells like viruses and bacteria. And the cleansed fluid is recirculated back into the lymphatic system and joins back into the circulatory system at your collarbone. So when you get an overaccumulation of fluid in the tissues because of the trauma of surgery, the transport capacity and the efficiency of the lymphatic system becomes overwhelmed. And so it needs a little bit of external help to encourage uptake of that fluid into the lymphatic system and through towards the lymph nodes.
Yeah. And, I think the thing that really, I think that's from a surgical point of view that's really quite important in this whole process is that, us horrible surgeons who loved to use cold Sheffield steel, never really understood that swelling post-surgery was actually detrimental to a good recovery and a good healing, because we know that swelling compromises the lymphatic system. It causes venous stagnation. It reduces the blood, the new blood getting into the healing tissue. And all of those factors lead to a buildup of what's called oxygen-free radicals. Oxygen-free radicals are the things that stimulate the inflammatory process. They're also damaging to new cells that are trying to heal, trying to repair. So that if by just allowing the so-called natural swelling to occur and not trying to help it, is really prolonging the recovery and making the recovery more uncomfortable for our patients, and also increasing the risk of infection. Because if you're getting that stagnation of circulation, this is obviously going to compromise the white blood cells' ability to defend against infection. So all of these factors, and we've seen this time and time again with our patients, and how wonderfully they feel after their lymphatic drainage treatment, and how we have such a low rate of post-operative infection. Our patients have really minimal to no pain in quite extensive procedures, and that's a testament to yes, good surgical care and good perioperative care, but also to the fact that lymphatic drainage does work.
Yeah, it's great to hear that coming from you, and it's I think that definitely more surgeons are getting on board with the fact of its benefits. There of course is the usual thing about scientific evidence and no clinical studies.
Mm-hmm.
And I remember you and I discussing the possibility of a clinical study, but how could you not give somebody MLD and then give someone else MLD and compare the outcome?
Yes, yeah, it's one of those things that we would have to design a model which replicates what happens with an injury, and be able to have MLD versus no MLD and compare the outcomes, and that's very difficult to do. Yeah. So we have lots of people following up, and some more questions, I hope.
Well, another one is, will MLD improve the results? And so, I mean, you basically have answered that.
Yeah.
It is by getting rid of that stagnant fluid out of the tissues that improves the whole wound healing process and optimizes scarring. And the scars, most definitely, when I are seeing people that come to me late for MLD, as opposed to those that are coming from early on and even pre-operatively. The scarring is so much better because of the MLD.
Yeah. Well, again, you know, what we mentioned earlier is that if you reduce or you minimize that swelling around the scar, then the scar has better blood supply, it has better oxygenation, and therefore it's going to heal better. I would just like to point out one little rider, that MLD is not going to make a bad result better.
No,
You know,
no.
you know, let's make sure we understand that. You know, it is one factor which helps to optimize our patient's recovery, and to avoid the possible complications, as you say, of wound healing problems and post-operative infections, etc. Yeah.
So next question is why, well, it says why only a few surgeons offer MLD sessions. So I'm not sure if that's whether it is surgeons that are recommending MLD or whether it is surgeons that actually offer it as part of their surgical care package. So I'm going to go with the second one, I think, because I think it is important that it is a part of the surgical care package.
Yeah.
I have I mean we discussed it at length 10, 11 years ago, and I've now just discussed it with some plastic surgeons in Northern Ireland, and
Right.
so that they are keen now to get the cost of MLD included in the cost of their surgical fees, which is fantastic.
Yeah.
And it would be wonderful if more clinics could offer that on site to their patients.
Yeah, and what's been great is that now that we're developing more relations with therapists like yourself around the country, we can ensure that even patients who are traveling from far distances can get access to either preoperative or postoperative MLD. So, you know, by building up that network, by sharing good evidence, good practice, we can ensure that as many patients as possible can benefit from MLD being part of their surgical care. And it's not only about plastic surgery. I think it's, you know, what I see with my orthopedic colleagues, with my gynecology colleagues, you know, they just don't even have any understanding about the benefit of something like MLD in therapy, and it's almost like not offering MLD to patients undergoing elective surgery, especially, is almost something that you'd say, well, is that almost a lack of duty of care when it's so profoundly beneficial for their recovery. So, you know, that's certainly the way that I look at it. That, you know, I wouldn't operate on a patient without providing post-operative care, and for me, lymphatic drainage is part of that post-operative care.
Yeah, I mean, it is without a doubt, it does speed up the whole healing process for patients,
Yeah,
gets them back to normal activities more quickly.
yeah, and
So
how?
even with orthopedics, you know, with I've seen quite a few patients that have had knee replacements and had massive swelling in their legs, and coming for some MLD has really changed their healing process. And
Yes, yeah. Oh, I can imagine for sure. Make a huge difference. You know, the just coming on to a thing, just how do you decide how many MLD sessions a particular patient should have, or is it based on your experience and what you recommend?
So I will generally have a rule of thumb, depending on the procedure. So, for instance, somebody that had breast surgery, so augmentation, won't need as many as somebody that has had liposuction or an abdominoplasty.
Mm.
And everybody heals differently. So, I generally will recommend an initial course of between 4 and 6 post-operatively. And then we reassess as we go along, depending on how the tissues are, how the swelling is progressing and reducing. So yeah, it's a movable feast, as they say. So
yeah, and I think it's very much looking at different procedures. So multiple facial procedures, as for example, when we do facial feminization surgery, have more swelling, more disruption of lymphatic drainage, and therefore will benefit from a longer course of treatments. Whereas, as you said, a pretty straightforward breast augmentation will usually recover quite well with a short course of treatment. And as again, tummy tuck with liposuction, again, more disruption of lymphatic drainage, therefore more benefit to do multiple treatments. Yeah.
yeah, and the timelines also will be a little bit different. So, again, depending on the procedure, will depend on when somebody would start having their treatment.
Yeah.
In an ideal world, I'd like to see people pre-operatively, so that they are getting that drainage nicely established before the surgery. As you used to say, it's like removing leaves from a drain before the storm hits.
Yeah.
And I mean, it's a brilliant analogy. It is just so I've stolen that off you, Chris, and I use it now.
Oh, you're very welcome. You're very welcome. I think it's very good way for patients to understand the benefit of doing the MLD. Unfortunately, with COVID over the past year, that's certainly not been possible for the majority of our patients because of self-isolation issues. We're certainly hoping that as things get better, we're able to then get back to doing all our pre-operative MLD on the day before the surgery, and then the post-operative sessions as well. So yeah, it'll be nice. It'll be nice to get back to some kind of normal activity and normal life for sure.
And are you fully open for business again?
We're going to be fully open from the 1st of May. We're getting everything organized for that to happen safely. Still, we still have to be careful. We still have to make sure that we protect our staff, but also protect our patients during this time. And honestly, I think it's going to continue that way until at least the end of the year, before we say that we're over the worst and we can manage this. So I think we all just need to be sensible about it and do our best.
Yeah. I suppose there will be a huge influx of new consultations then coming up in the next 6 months.
Well, we've been pretty busy, and a lot of our patients know that, and know that we've been working tirelessly to make sure that we maintain a reasonable service. It's not been easy, but yes, we are we have lots of patients waiting for consultations, lots of patients waiting for surgery, because the hospitals have been restricted by what times they can offer. So there's a whole train of things that happen, and managing that has been somewhat of a challenge. I see there's a question from Kylie. Will I do surgery if a patient refuses MLD? Yeah, very interesting question. Obviously, it is a somewhat of a personal choice, but we highly recommend that you do have your MLD sessions, because of what we've discussed previously. I would certainly want you to understand that MLD is not an option in my practice. It is part of the service that we provide, and our duty to you is to provide the best possible service, and your duty to yourself is to make yourself aware of the benefits of all of the services that we include in our pre-operative but also post-operative care. And it's very rare that any patients refuse to have MLD. We also because we're now working very well with a network of therapists around the country. If it's a problem for you traveling into the clinic to have MLD, then we can arrange for you to have that done locally. So there's ways around all of these things to benefit you.
I don't know many people that wouldn't want to have MLD.
I know. Until you have it, you realize, well, I don't know why everybody doesn't want to have MLD.
I think it is the name is quite off-putting, isn't it? Manual lymph drainage.
Yeah, and that's why I've really, over the past couple of years, I've really tried to talk about lymphatic drainage therapy, rather than a manual lymphatic drainage, because I think manual lymphatic drainage is not a good term of reference, to use. I think therapy is much better. It's doing treatment, and it's addressing the lymphatic stagnation is what we're aiming at. So I think we'll slowly change the name to something that actually suits the quality of the procedure much better.
Yeah, I mean, it definitely sounds like there could be a hose or something involved by calling it drainage. It's not.
Yeah, absolutely. Oh yeah, no, a lot of patients ask, is it painful? Do you use a machine? And I know that some therapists do use a mechanical lymphatic drainage device, which in some patients I think certainly very beneficial. But for the majority of our patients, I think good human hand touch is far more accurate and gentler. So can't beat it.
I mean, the power of human touch, really, you can't beat it, can you?
Yeah, no, for sure, without any doubt. No, good.
So there's another question. What are other ways to reduce swelling besides MLD?
We lost your volume there a second, Petra.
What are the other ways to reduce swelling besides MLD? So the big one is wearing compression.
Yeah.
And walking around, muscle movement and joint movement, nice, gentle muscle movement to stimulate the lymphatic system, and deep abdominal breathing, nice, relaxing breathing, walking around, wear your compression, and have your MLD.
Yeah.
Also, to avoid salty foods and anything that is going to be creating more inflammation in your body, you want to try and avoid.
Yeah. So cut out all sugary things before surgery and after surgery. Reduce your carbohydrate intake. Make sure you're getting good proteins in your healing period. And as Petra said, the old days is of you had an operation that you stay in bed for the next 2 weeks resting, is totally goes against what we understand about human physiology and the healing process. So I love your idea about combining lymphatic drainage therapy with gentle physiotherapy in the post-operative period. And I think that's a brilliant combination of things, getting patients, educating patients, and also getting patients to understand what they can do in their post-operative period. So, if you'd like to expand on that a bit about what your thoughts are and why you thought about combining those two things, how do you think it'll work with surgery patients?
Well, just a question that often comes up is, when can I exercise again? And I mean, I think it's really important that people are exercising before they have their surgery so that they are fit and healthy. And then afterwards, as you say, to just stop and do nothing is not benefiting the patient themselves. So I've been working with a physiotherapist that I work with, and she also is an anatomy and motion instructor and a Pilates teacher. And so we thought that we would try and put together some exercises that would be procedure specific,
Mm-hmm.
that are not raising the heart rate, and it's not increasing the breathing rate, but more that it is muscle movement and joint movement, so that it is stimulating the lymphatic system, which is going to help reduce swelling.
Yeah.
So it's a combination of doing movements while you're wearing your compression, building in deep breathing into it so that you're breathing on each movement. So inhale, do one movement, exhale, do another movement, and then combining that with the MLD.
Yeah, fantastic. Oh no, I think it's we've unfortunately COVID does have some positive things. Because of COVID, we've had to be very conscious of getting patients to do their deep breathing exercises before surgery and after surgery, because obviously we don't want them to get any kind of lung problems, but also clots in the legs, pneumonia, avoiding those things. So we've very much been pushing with all our surgery patients about deep breathing exercises. So we've as before, we've actually been thinking along the same lines about how to optimize our patients' recovery. I think, and I love the idea of the gentle joint movement, because, as you say, that's stimulating muscle movement. Muscle movement is stimulating lymphatic drainage, and therefore you're actually doing your own lymphatic drainage therapy on your own, by doing those gentle exercises. So it's the wonderful thing about medicine. We learn things every day. The day we stop learning is the day we have to stop practicing, because that means you think you know it all, and you think you think that there's nothing else for you to improve, and that's a very dangerous place to be. You know, I love sharing ideas with professionals like yourself, and being able to come up with new and innovative strategies to help our patients recover and get a better outcome, better result, etc. Yeah, so it's brilliant.
Good.
Good.
So yes, that's all the questions that there were. I don't know if there are any more that have come in as we have been
Yeah,
chatting.
I haven't seen any other questions. You know, we have a lot of information about lymphatic drainage on the website. We can provide any information. So just ping any questions you have to Nicole. You know, as Petra said, Petra and I go back for, geez, I didn't think it was 10 years, but it must be at least 10 years, yes. When we started, we were the first clinic in the UK to start offering lymphatic drainage as part of their surgical care. And we've gone from strength to strength in doing that. And you know, I'm very keen to learn from you about combining this with physiotherapists. You know, your physiotherapist sounds like the ideal person to get involved, because of how she looks at it as a very holistic way, and it's something that I would certainly love to look at, and how can we incorporate that into our post-operative care regime. To again, it's all about, you know, doing things to benefit our patients, to give them a great outcome, give them a very good recovery, that it's a positive experience. And you know, many of our patients are very anxious because of the surgery, and therefore if you can turn that anxiety and that nervousness and that worry into a very positive outcome, you really are changing their lives. So
Yeah, I mean, it is a very stressful, it's a stressful thing to go through, having surgery, the build up to it, and you
mhm,
know, not really knowing how it's going to go, what the outcome's going to be.
yeah,
Um, yeah, so yeah, MLD is brilliant for relieving and reducing that stress. Deep breathing. And if people are into meditating, you know, and doing mindfulness, it's also really good, because stress and anxiety actually can affect your healing as well.
absolutely, absolutely. And medicine for so long has ignored all of those areas in helping patients to recover, whether it's recovering from surgery or from cancer therapy or from a stroke. All of those things, you know, they have so much positive effects on our recovery, and optimizing our recovery. That, you know, it's good that there are like-minded folk around that are now starting to get on board and be able to look after our patients. Brilliant.
Brilliant.
Yeah, well, it's fantastic having you with us for our Instagram live, and hopefully you can join us on some other topics around that whole post-operative care. And yeah, please do keep me updated on the combination with your physiotherapy colleague.
I will.
We will look forward to working with you. I know we have many patients coming now from Northern Ireland, so we will certainly going to be sending them your way to have their post-operative MLDs, and we'll see you soon again. Thank you everyone for
That's
joining
great.
us.
It's lovely to see you.
If you have any questions, then just post them on to Nicole, and we can get them answered for you. If you need any information, if you want to contact Petra as well, Nicole will give you Petra's contact details as well.
Great. Thanks very much for having me.
Have a lovely weekend.
You too, Chris.
Bye.
Bye.